elements of a patient's self-care plan?
So I define self-care as everything a patient does to manage their disease. So I think the first element is really being educated about your disease. I think it's also really important to be engaged in your care and to be part of those decisions with your that are made about the treatment of your disease with your doctor. And then there's all the other things around it. So as part of being engaged in your care is you need to be monitoring your disease because you're the one who knows. There's all the healthy lifestyle things. You know, treatment is not just about medications. It's also all those other things you do for your health. So your diet, being regularly physically active, maintaining a healthy weight, considering stopping smoking if you're a smoker, because we know that smoking is really bad for inflammation. It triggers inflammation and makes the disease worse and the disease not respond as well to medications. And physical activity, sleep, rest, making sure you manage your energy and your stress and your emotional well-being. It's not just all physical.
Yeah. When you talked about exercise, what are the benefits of range of motion exercises? Describe those and why are they important?
So range of motion exercises is when you move your joint in its full range of motion. And it's particularly important in patients with psoriatic arthritis because one of the common complications of the joint damage is loss of movement of the joint. So you need to be regularly moving your joint to keep your range of motion.
So what is the difference between strengthening exercise then and aerobic exercise?
So, you've just pointed out the three kinds of exercises that are really important in a person's exercise plan. And the strengthening are the ones that are strengthening the muscles around the joints. And those are crucial because strong muscles around the joint support the joint. They make the joint more stable. Whereas aerobic exercises are exercises that get your heart pumping so that you have the fitness to be able to do those activities.
So when we talk about relieving painful joints, and you're using either ice or heat, what do you need to remember? What are the key principles?
Yeah. So ice is very helpful to reduce inflammation. Similarly, when people have active inflammation and the joint is hot and swollen, ice is what will bring down the inflammation. And then there's pain relief. So heat and cold are both effective at reducing pain. And often what's most effective is alternating heat and cold. But sometimes what will be really helpful for reducing stiffness and pain is pure heat. And people are very different in their tolerance to heat and cold. So for some people, heat works and they can't tolerate cold, and other people do really well with both. So it's whatever works for you.
What diet changes can someone make that would be beneficial to their psoriatic arthritis?
So that's a very commonly asked question. So what is important in terms of a diet for a person with arthritis is having a healthy, balanced diet. There are some foods that are thought may be helpful for reducing inflammation, things like omega-3 fatty acids, and then there's things like turmeric and other foods that may have anti-inflammatory properties that might be useful for you to incorporate in your diet. And there's a lot out there on the internet and in the media about diets, and the evidence is really lacking for a lot of those recommendations, especially in terms of avoiding foods.
Okay. What is an effective if there is one, what is an effective self-care technique for the skin symptoms?
So, there's a lot of dryness to the skin with psoriasis, so making strategies to prevent further dryness of the skin, so a humidifier or using moisturizing lotion is something that can be very helpful. Avoiding anything that's irritant to the skin, like lotions that are highly perfumed or that have
chemicals in them of
yes,
any type. Yeah,
that's right.
Okay.
And then the rest is, there's a lot of topical treatments that are very effective for psoriasis. So if it's not well controlled, then you need to see a dermatologist and get a cream that's prescribed. And then the other one is light. So UV light can help psoriasis. Getting their skin exposed to light with appropriate sun protection can be another way of managing psoriasis.